finish it up. Alright, so we're back to our orthopedics, and we're looking at some one or two topics as related to orthopedics. We left the orthopedics world for a while, but I'm actually back now with a whole lot of consistency. So this is us talking about leg length discrepancy. So for the leg length discrepancy, we want to now talk about a test. As you do this test for a patient that you feel like their legs, the length is not the same thing. So you do this test to confirm, okay, that their leg is not the same thing, and also know at least the length at which the other one is shortchanged by. So block testing for leg length discrepancy, just so you know, is a clinical bedside method. Okay, so it's used to estimate the differences in leg length. So it helps to distinguish between true, that structural length discrepancy, and sometimes apparent. Okay, so the patient position. So the patient stands upright, barefoot, with the knees extended. The pelvis is what observed from behind. Okay, so you actually first of all observe the pelvis from behind to see if there's a tilt. Do you understand? So procedure. So a wooden block of known thickness is now placed under the shortened limb. Now blocks are added until what the pelvis becomes leveled. So as you are adding the height of the block, you are checking for the hip of the patient. Is it aligned or is tilted on one side? So total height of blocks used is now what approximately the what length, okay, that the leg is actually short-changed by. Do you understand? So observation, pelvic leveling indicates that what the discrepancy has been corrected. Okay, so if discrepancy persists despite blocks, it may be functional. Do you understand? It may be an issue inside, not only anatomical issue. Now types of leg length discrepancy: have the true one, which is this actual shortening of the bone. But we have the functional one, which this one is basically there's a problem. It's due to an underlying issue. Okay, joint contractures, scoliosis, and the rest of it, osteoporosis, and the rest of it. So advantages: is a quick method, is inexpensive, and it's non-invasive, and it's a very easy tool to use in the clinic.